Daytime Doctor TV is about to change. The days of traditional dental thinking are over. We're here for dental consumers who are tired of crowns, tired of repeated invasive procedures and dealing with problems in their mouth that seem to never go away. There is a better way. There is an alternative approach leading to whole mouth and whole body health for the rest of your life. Stay tuned to learn more now. This is the Dr. Shoup Show. Here's your host, Dr. Randy Shoup.
Hello, everybody. This is the Dr. Randy Shoup Show, and I am your host, Dr. Randy Shoup. I practice dentistry and microscope dentistry by Shoup here in Indianapolis, but I also get the pleasure of traveling the globe teaching other dentists an absolute revolutionary form of dentistry called biomimetic dentistry. It is the evolution and revolution of how you should expect your dentist to treat you and to treat your teeth. We are tired of the concept of grinding your teeth down to crowns and grinding your teeth in order to facilitate a restoration that really isn't necessary. You've had people tell you you have to have or you need a crown on that tooth. I'm here to tell you that is not the case and probably not accurate. It is wonderful because in this program, we're going to be able to bring to you information that you're going to find no other place. We are going to give you the power. We are going to give you the knowledge that is going to allow you to make really high quality healthcare decisions for yourself. We'll not stay focused entirely on dentistry. We're going to address nutrition. We're going to talk about how important your nutrition choices are in terms of how well you live your life for the rest of your life. Did you know that there's a substance called ozone happens in our atmosphere and it can be remarkable in helping your body heal? Did you know that all the controversy around CBD oil may or may not be true? There are myths, there are legends, but there is also truth to it. But this is where you'll be able to come to learn this information accurately, factually. We are not going to play or delve into any fake news. We're going to give you the science, the reasoning, the skill, the experts behind it. And that's what we're going to be able to do for you. We're going to bring for you every week an expert in some particular facet of your healthcare and your healthcare decisions. These experts are going to have a conversation with you and me. You're going to be able to listen to them delve deeply into various topics and various subjects that are going to be absolutely essential for you to be able to make high quality medical and dental decisions for yourself. What if I told you that children in today's world should never have a cavity as long as they live? In today's world of dental techniques, we have the ability of putting magic coatings on your children's teeth and literally making the teeth impervious to decay. Would that be a game changer for you and your family? Would it make a big impact in the health of your family and in your budget, knowing your dental costs in the future are going to be minimal? Well, that's what we're going to do. That is our pledge to you. And today we're going to bring to you Dr. Jay Beagle, and he is an expert in implants. And as soon as we come back, you're going to see amazing things with implants right after this. Well, welcome back, everybody. And as promised, we are joined by Dr. Jay Beagle. He is a periodontist and an implant specialist. Jay and I have worked together for a number of years. Jay, it is great to have you here. Truly an honor. Thank you very, very much.
That's my pleasure. Thank you for inviting me.
Well, we're taking time out of your busy day, and we caught you actually in between implant surgeries. And so I thank you very, very much for carving out some time for us. I know the viewers are going to really appreciate what you and I can share with them. For the listeners, please tell us a little bit, quick history. Where did implants come from? How long have they been around? And, what's kind of the history behind implants?
The implants which we use today in dentistry originated in Sweden It was initially developed by an orthopedic surgeon named P.I. Bronnemark, and their first publications were performed in 1981. At that time, they had begun their studies in 1965. So over that period of time, they actually treated approximately 3,000 implants in patients and had a remarkable success rate of 81% in the upper jaw and 91% in the lower jaw, which was completely unheard of at that particular point in time in 1981. This technique actually was developed in Europe and then spread across the world from there.
Yeah, yes, once implants got going, once they really, everybody knew that they were reliable, it has spread like wildfire and has been really become a staple of a lot of dental practices around. When did you get involved? And tell the viewers how long you and I have been restoring patients with implants.
I became involved with implant dentistry in the late 1980s. In fact, I actually took one of the Bronnemark courses in Boston in 1988 or 1989. So I've been involved with implant dentistry for quite a while, and I know you and I have both been treating a number of patients in that time frame as well.
Yeah, implants have become a major part of my practice, and I rely on you to be my surgical part in terms of placing the implant. Let's talk a little bit about what applications there are for the patient for implants. What can we do for the patient? What are the various procedures that they can have huge benefits from by using an implant? Let's start with the simplest one, like a single tooth replacement.
A single tooth replacement is a very common procedure for patients just because of the number of individuals that are unfortunate enough to lose one tooth over their lifetime. Quite often, that tooth is the most commonly treated tooth in dentistry, the lower or upper first molar. That's the first tooth that a person gets as a child, probably the first tooth they have a filling, maybe the first tooth that needs a root canal or a crown. Unfortunately, maybe the first tooth that requires removal. And at that point, discussion can be made with regards to how to replace that tooth. And a dental implant is a perfect opportunity for that patient to have that tooth returned to their mouth.
Well, we're going to show a video of how that single tooth replacement works. And then we're also going to show a video of how the option for a 3-unit bridge instead of an implant. It's been tradition in dentistry to grind down the two adjacent teeth that are perfectly healthy, perfectly normal teeth in order to facilitate replacing it. With the implant option, you get to leave those teeth totally alone. You get to leave those teeth totally unmarred and scarred and damaged, and yet still replace your tooth. So it's a huge change for the patient, benefiting them from not having to have their teeth destroyed.
And not only that, it makes cleansability much better for patients as well. They no longer have to thread dental floss underneath the bridge. Now they have a single freestanding tooth again that will react just like a natural tooth would.
Sure. There are other applications as well. Talk about some of the other ones, for example, with something that has to be removable, or maybe even we'll go into talking about dentures.
Well, the two most common removable prosthetics for patients would either be a removable partial denture, which as people know, it's when you have some of your own natural teeth, but are missing some of your own natural teeth as well. So a partial denture replaces those teeth that you've lost, but connects or hooks onto the remaining natural teeth. The other removable option that people have, of course, is a complete denture where they have no teeth at all, either in the lower jaw or in the upper jaw. Dental implants work beautifully for these particular patients.
You know, you and I treat people on a regular basis that have lost a significant part of their teeth, or they've lost all of their teeth, and they're so used to wearing something that is uncomfortable, that moves around, that becomes loose and comes dislodged. It's embarrassing, it's difficult to eat, and with implants supporting either a partial denture or implants supporting either a full denture, then they have a whole new world of reliability. They have a whole new world of security. They can chew so much more effectively. Talk about how much of a difference there is from the patient's perspective in terms of having a partial or a full denture that is just simply tooth supported or gum supported, as opposed to a partial that is supported by an implant. How big of an improvement does a patient realize when they go to implants?
Well, it's a significant improvement for patients when they have dental implants. Let's take the examples that you've just described, that being a removable partial denture or a full denture. What patients may not realize is that the bone that the denture sits on is a rather dynamic tissue. That means that over time, that bone wants to melt away, much like an ice cube on a table. 1 minute it's there, the next minute it's gone. And so for those patients, they may find initially that their partial denture or their denture may actually fit quite well for the first year or two, but suddenly it starts to feel loose. And it gets loose because the bone is changing or melting away underneath the prosthetics. The benefit of the implants for those patients is that it stops the bone from being lost, and it enables that prosthesis to sit more firmly and securely in the patient's mouth. So obviously they're going to be much, much more comfortable long term.
Yeah, I find that to be one of the biggest advantages for the implants, is that the implant stops the process of their bones dissolving away. The body reads the implant just like it reads a real natural tooth and says, I need bone here. I need to keep this implant supported, so the jawbone doesn't melt away like in a lot of cases where the teeth are missing. You know, I'm sure many of the folks that are watching are seeing all the television ads for the dentures in a day, implant supported dentures in a day. I know that they usually use 4 implants to support what they're doing, and I'm confident that the reality of what the patients get at the end of the day is different than what they may perceive they're going to get. Let's talk about these dentures in a day, these life-changing implant cases, and how this actually works, and is it really an advantage for the patient?
Well, I think certainly the patients are going to benefit from that type of treatment, but there are some issues that they may not realize, that they don't realize when they're watching television and they see some of these ads appear. The main issue, I think, is that they are receiving a denture which is attached to the implants the day of the procedure versus what they might really want to have, which are teeth. So a denture is, again, plastic teeth with plastic gum tissue, and it's just going to feel and look like a denture. It will give you some support and function, but it's not what they perceive to have with a single tooth or a bridge or something that's traditionally more like they believe traditional dentistry can offer them. That can be done, but that's not what's being delivered in some of these clinics that advertise on television.
And the other thing too is that they base all of this on utilizing 4 implants to support all of that teeth and all of that dentition. And oftentimes it works out well, but if in the event one or more of those implants fails, then you're left with not enough implants to support what you bought, and therefore you oftentimes have to start over again. That's a real big risk in terms of supporting all of that tooth structure on simply 4 implants.
That's absolutely true. So if you happen to be unfortunate enough to lose one of the 4 implants, not only do you need to go back and replace that implant that was lost, but quite often it may be difficult to retrofit the original prosthetics onto those 4 implants again, and that may need to be refabricated also.
Excellent. We're going to take a quick break, and when we come back, Dr. Beagle and I are going to show you some absolute rescue cases we get on a regular basis where the implants weren't done correctly and it left the patient with a very, very unsatisfactory result. He's going to show you how we make all that better right after this. Well, welcome back, everyone. It is great to have you here. We are going to continue our conversation with Dr. Jay Beagle. Jay, as we move forward and finish our conversation together, one of the things that's really important is to have everybody understand what should the patient in today's world expect in terms of longevity, durability, what sort of value should the patient look for if they have implant restorations, if they have either a single crown or a bridge or a denture, what should the consumer expect out of the success of their implants?
Well, as I mentioned at the beginning of the show, dental implants have been in patients' mouths since 1965. So that's roughly 53 years. Um, I would anticipate as time goes on, we're going to see in most patients this to become perhaps a lifetime benefit for them. In other words, if they have an implant placed today and it's placed properly and it's restored properly and they maintain it properly, I would like to believe this will last their lifetime.
Yeah, that's when I talk to my patients that you and I have treated together. I fully expect once we restore them, once we put them back together with the implant procedures that we do, I tell the patients I have every expectation that this restoration will last them as long as they do. And so
That's
we
correct.
want the patient to understand, yes, there is a bit of an investment. Yes, there is a bit of an investment in time and effort to put the implants in, but it should be an investment that pays them long-term dividends. I know you track very meticulously the success rate of how you place implants and how we restore them. For the viewers, give them a sense of what our success rate is. Are we as good as Ted Williams in the batting average, or are we better?
We're actually better. It's surprising that you can be this successful, but I've placed roughly 18,000 implants since approximately 1990, and my success rate is a little bit more than 99%. And that's placing implants in all different kinds of sites and all different kinds of patients, young, old, immediately placed implants when the tooth is removed, and implants placed in sites where teeth have been gone for many, many, many years. Uh, and the reasoning I think our success rates are so high is that we pay attention to what the patient needs, but we're also using quality components from quality implant companies. And I think that makes a difference too. We need to have a partner helping us in the manufacturing world.
Well, that's a really important point, because tell the viewers, how many implant companies are there now that have all jumped on the bandwagon and want to be a part of the implant world? How many companies are there out there now manufacturing implants?
There are several hundred implant companies today in the world. Obviously, some of those implant companies are extremely important companies. The top two or three are the ones that most of us use, but there are some lesser quality companies. And my worries for those patients that have implants placed in their mouth with components from a lesser known implant company will be the fact that that company may not be around for as long as that patient will be around. Therefore, if there's a need to change a part, change a crown, replace something, those components may not be available. And for that patient, that will be a real problem.
You know, you and I have faced that exact problem. So let's tell the consumer, the viewer, the top three implant companies around the Midwest here in the US, that they should be able to know the names of these companies. And when their dentist says, well, you need to have an implant, the patient should be able to say, what implants are you using? What implant company is making the system that you're using? So what for you would be the top three companies that the consumer should know in terms of being able to have a really good conversation with their dentist before they have an implant placed?
Well, the top three companies in worldwide are Straumann, which is a Swiss company, um, Nobel, which is a Swedish company, and Astratech, which is a Swedish company. So you're seeing that these companies are all European, but I should also add that the companies also have manufacturing facilities in the United States. So you are buying an American product, even though the companies are actually headed in Europe.
And that makes a big difference because certainly the availability of parts, you and I have had patients come to us and want you and I to restore them, to fix them when they have something that's failing. And you and I have found the situation where they have an implant system placed that is from one of those way outlying tiny companies, and the available parts don't exist anymore. The company has been absorbed by somebody else or has gone under, and they were used because they were less expensive. They were used because some salesman sold something to the dentist, and the dentist said, well, this is a good idea and I can probably make some money on this. And now the patient is left with a disaster because there's no parts available. There's no way of fixing whatever it is that they need to have fixed. And you and I are faced with the challenge of removing that implant and then putting a new implant in that has reliable components. And it is hugely expensive for the patient, and it really is a lot of trauma to the patient to take an implant out and put one back in. I know you and I are faced with the challenge of rescuing a lot of implants, and we're going to show some examples of that. One of the first ones, and one of the things that really scares people, is if you have an implant placed in the front of your mouth, an upper front tooth. And we're going to let our audience look at a case where you and I were faced with trying to rescue this poorly placed implant. Tell the viewers, how critical is it that the implant is placed in the right location and the restoring dentist really knows what they're doing?
Well, in the past, with implant dentistry, surgeons were generally placing implants where the bone existed. And that's what we call a bone-driven system. And as a result of that, many times the implants were not restorable. And when they were restorable, they looked very ugly. And we still see people doing this today, especially individuals who aren't well educated or well trained in implant surgery. So there's an art and a science to how to properly place a dental implant, especially in the front part of the mouth. And as I tell many patients, we only have really one opportunity to do this right the first time. Anytime thereafter, if there's a problem or a complication, it becomes a real struggle to try to improve those situations for patients. And sometimes you can, and sometimes you can't.
Well, you're going to see on the screen the subsequent positive outcomes when an implant is placed in its correct location. And I'll challenge the viewer looking at the screen right now to tell me which one of these teeth is the implant supported teeth. The thing that makes the big difference is they should disappear. They should look and act just like a natural tooth. And what you're seeing on the screen right now is simply the science and the art of Dr. Beagle and the science and the art of myself in terms of being able to put implants in the correct location and restore them, making them duplicates of what the natural tooth should look like. This is the result that you should expect in terms of aesthetics and function, as opposed to the first picture we showed you, which violated pretty much every rule in the book in terms of how you restore a missing tooth with an implant. This is why you and I recognize a 99% success rate, because we pay attention to the details. Jay, as we have just a minute or so left, address, is there any validity to any of the internet-based scaring things? For example, I shouldn't have metal in my body. Implants create metallic magnetic fields that eat my brain cells away. Is there any validity to any of that?
Well, first of all, implants today are made of titanium, and titanium is non-magnetic. And so we do have a number of patients that ask us, gee, I have to have an MRI performed at a hospital. Is it safe for me to have that done? And the answer, of course, is yes, because titanium is non-magnetic. But there's virtually nothing wrong with putting a dental implant in a patient. The patient isn't going to have any long-term illness or consequences to their medical health from a dental implant.
Well, Jay, I cannot thank you enough for being with us. I know the information you've shared has been absolutely invaluable. It's a pleasure and an honor to have you with us. Thank you very, very much. I know we've taken time out of your busy surgical schedule. I really appreciate it. Thank you.
It's my pleasure. Thank you, Randy.
Cool. All right, well, there you have it. This is probably the most comprehensive look at dental implants you will get anywhere, and that's why you come here to the Dr. Shoup Show. I want to bring to you the most current, the most up-to-date, and the most sophisticated information that lets you make decisions that are going to make high-quality, impactful results for your life. We want you to be happier. We want you to be healthier. We want you to spend your medical dental dollars wisely. We want you to have absolutely stunning and fantastic results. If I can be of any help at Microscope Dentistry by Shoup, I always want people to reach out to me. It is always a pleasure. It's always an honor for me and my team, like Dr. Beagle, to be able to restore you and put you back to a state of health. So, until you and I chat again, be sure to brush and floss.